Do inversion tables work and do they help with back pain? My name is Dr. Paul Betts, and this is a question we get in the clinic very frequently. How do those inversion tables work? Do they work at all? What's been your experience with inversion tables? The idea of this concept or theory is common because we know that as we age, we lose height in our spines. Our spines are made up of two components. We have our bones, and then we have the disc, which sit in between the bones and act as shock absorbers or little cushions. So a third of the height of the spine is actually made up by the disc. So as those discs shrink, wear out, or degenerate with age, with time, or with injuries, then we can lose some of the height in the spine. The concept of an inversion table is if we can remove some of the gravitational pull that we are with 24 hours a day that's on our spine, or at least the hours that we're standing up or sitting down, if we could take some of that pressure off while we're on an inversion table, then it could alleviate some of that pressure. Now, typically, there's not any problems with an inversion table. The dangerous thing can be if somebody gets stuck on it or gets stuck upside down. We actually had that happen with one patient. So sometimes it can increase some of the symptoms if they get stuck on it, but it's not a real common problem. So there's not a lot of big dangers with the inversion table, but the only problem with it is that it's not very specific. Now, it's a very general stretch of the entire spine. If a patient is having a specific problem, let's say they have a herniated disc or a bulging disc between L4 and L5, we want to be specific with our treatment to that particular area. The only way to be very specific with the treatment of a bulging or herniated disc would be to use a spinal decompression table. We can program the decompression table specific to the level of the disc herniation. So really, inversion tables are not a bad thing. Now, how great they work depends on the individual, depends on the patient, but the theory behind it is good. It's good to stretch the spine. But if we're going to treat a condition specifically, we need to have a specific table, a specific protocol. We need to have a specific treatment to stretch the spine and focus on the area that's actually been injured. I hope you like this video. If you have an inversion table and you love it, let us know. If you have one and you don't love it, then let us know about that as well. But we'd love to hear from you. Thanks.